Do you know that according to research studies, over 80% of women with ovarian cancer experience symptoms early, but most fail to recognize them? But here's what most people aren't paying attention to. The early symptoms of ovarian cancer can be elusive but significant. Every year, thousands of women are diagnosed too late, often leading to limited treatment options and poor outcomes. According to the American Cancer Society, ovarian cancer ranks fifth in cancer deaths among women, taking more lives than any other cancer of the female reproductive system. What's even more alarming is that only about 20% of ovarian cancers are found at an early stage. When ovarian cancer is found early, about 94% of patients live longer than 5 years after diagnosis.
Ovarian cancer has sometimes been called the silent killer, in that some of the symptoms and signs that ovarian cancer can cause are not very clearly apparent. But I think we're coming to recognize that there are some signs and symptoms that women need to be aware of.
In the next few minutes, I am going to share with you 6 symptoms of ovarian cancer that could help you or a loved one detect it early. These are not the obvious symptoms, like continuous bleeding, you have likely heard about. They are the sneaky signals your body sends before the disease progresses. Most people ignore them completely, but recognizing these signs early can make all the difference. And let me be clear, this is not just another list of vague symptoms to fear. We'll focus on specific, scientifically backed warning signs that have already saved lives. Stay tuned because this is not about scaring you. It's about empowering you with knowledge. By the end of this video, you'll have all the necessary tools to detect ovarian cancer early and increase your chances of successful treatment. But before we continue, this content is provided for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider with any questions about your health or a medical condition. Now, let's dive in. 1. Abdominal or pelvic pain.
Ovarian cancer is often referred to as a silent killer, but what we've learned is that that's not really true. Most women who develop ovarian cancer have symptoms for 6 to 8 months prior to their official diagnosis. Most of these women have gone to see multiple doctors and have been diagnosed with things like UTIs, irritable bowel syndrome, and any other host of problems.
As per research, one of the most significant early symptoms of ovarian cancer is abdominal or pelvic pain, a discomfort that often goes unnoticed or is misattributed to menstrual cramps, digestive issues, or muscle strain. Unlike transient pain, this symptom tends to be persistent, progressively worsening, and not relieved by over-the-counter pain medications or typical remedies. Pelvic pain associated with ovarian cancer may feel like a dull ache, a sharp stabbing sensation, or even persistent pressure in the lower abdomen. This occurs because the growing tumor or associated inflammation can press against surrounding organs, tissues, and nerves. The pain can sometimes radiate to the lower back or thighs, further masking its origin. One of the challenges with identifying this symptom is its non-specific nature. Many women may write it off as related to their menstrual cycle, aging, or gastrointestinal problems. However, pain from ovarian cancer often doesn't follow a predictable pattern and is more constant or recurring than what's experienced with benign conditions. If you're experiencing persistent pelvic or abdominal pain that lasts for more than a few weeks or becomes more intense over time, it's essential to seek medical attention. Understanding the significance of persistent pain as a warning sign can lead to earlier detection and dramatically improve treatment outcomes, potentially saving lives. 2. Persistent bloating. Another significant early symptom of ovarian cancer is persistent bloating, a symptom often dismissed as a minor digestive issue. Unlike occasional bloating caused by overeating or gas, this type of bloating tends to be frequent and prolonged and doesn't resolve with typical remedies like antacids or dietary adjustments. Persistent bloating often feels like a tight, swollen, or heavy sensation in the abdominal area. This occurs because ovarian cancer can lead to fluid buildup, known as ascites, or cause inflammation in the pelvic and abdominal regions. Over time, the bloating becomes more noticeable and is often accompanied by visible abdominal distension, making it difficult to fit into previously comfortable clothes. What makes this symptom particularly concerning is its sneaky onset. Many women attribute it to benign issues such as irritable bowel syndrome, premenstrual syndrome, or even weight gain. However, bloating related to ovarian cancer typically doesn't fluctuate and may worsen over weeks or months. Suppose you notice persistent bloating that doesn't go away, especially when accompanied by other symptoms like pelvic pain, changes in appetite, or frequent urination. In that case, it's crucial to consult a healthcare provider immediately. Early detection of ovarian cancer when it is still localized significantly improves survival rates, with studies showing a 5-year survival rate of over 90% in such cases. Before we move on, if you are looking to dive deeper into the early indicators of cancer, be sure to subscribe to the Quick Time newsletter linked below. Each week, we share expert-backed tips, delicious recipes, and actionable steps to help you reduce weight and feel your best delivered right to your inbox. 3. Changes in appetite. A notable early symptom of ovarian cancer is changes in appetite, particularly the sensation of feeling full after eating only a small amount of food. This symptom, known as early satiety, can develop subtly but often becomes more pronounced over time. Unlike normal variations in hunger levels caused by stress or diet, early satiety linked to ovarian cancer is persistent and unrelated to recent eating habits. It occurs because ovarian tumors can produce substances that affect digestion or cause inflammation, leading to pressure on the stomach and surrounding organs. Additionally, fluid buildup in the abdomen can crowd the digestive system, intensifying the feeling of fullness. Many women experiencing this symptom might notice a gradual decline in their appetite or find it challenging to eat meals they once enjoyed. Some may inadvertently lose weight or develop nutritional deficiencies as a result. These changes are often mistaken for common issues like acid reflux, indigestion, or lifestyle-related dietary adjustments, delaying critical medical evaluation. Paying close attention to this seemingly minor but consistent change in your eating patterns can be a vital step in catching ovarian cancer early when intervention is most effective. 4. Increased urinary urgency or frequency. An often overlooked early symptom of ovarian cancer is increased urinary urgency or frequency, a sudden and persistent need to urinate more often than usual, even if the bladder isn't full. This symptom is frequently mistaken for a urinary tract infection or normal aging-related bladder changes, leading many women to delay seeking further evaluation.
Urgent need to pee or needing to pee more often. Now, this symptom is important as often it's a symptom that's overlooked, possibly as recurrent urinary tract infections, even though your urine dipstick test and urine culture tests might keep coming back as normal. And the reason for this symptom is usually that ovarian cancer cells have studded the outside of the bladder wall, or when fluid in the pelvis is compressing or pushing down on the bladder, causing you to feel like you need to go to the toilet more often to pee.
Urinary symptoms linked to ovarian cancer occur because the growing tumor exerts pressure on the bladder or pelvic area, reducing bladder capacity or irritating surrounding tissues. Unlike UTIs, this increased frequency or urgency is usually not accompanied by burning sensations during urination or other signs of infection. Some women also report difficulty emptying their bladder, adding to the sense of urgency. This can become more noticeable over time, disrupting daily activities and sleep patterns due to nighttime urination. What makes this symptom particularly concerning is its persistence and progression. Temporary bladder changes caused by hydration levels or lifestyle factors typically resolve on their own, but urinary symptoms associated with ovarian cancer often worsen, regardless of fluid intake or bathroom habits. If you experience persistent urinary urgency or frequency, particularly alongside symptoms like bloating, pelvic pain, or appetite changes, it's crucial to seek medical attention. Recognizing and addressing this symptom as a potential warning sign can help catch ovarian cancer in its earlier, more treatable stages. 5. Unexplained fatigue. Unexplained fatigue is another early symptom of ovarian cancer that is often overlooked or dismissed as a result of stress, busy schedules, or aging. However, The fatigue associated with ovarian cancer is persistent, debilitating, and unrelated to recent activity levels or sleep quality. This type of fatigue stems from several factors, including the body's response to the cancer itself. Ovarian tumors can produce inflammatory molecules and disrupt normal bodily functions, leading to a constant state of exhaustion. Additionally, the presence of cancer may cause anemia due to blood loss or impaired nutrient absorption, further exacerbating feelings of weakness and lethargy. Unlike ordinary tiredness, which improves with rest or relaxation, cancer-related fatigue persists regardless of how much sleep or downtime you get. Many women describe it as a profound lack of energy that interferes with daily tasks, making even simple activities feel overwhelming. Unfortunately, because fatigue is such a common complaint for various conditions, it often goes unnoticed as a red flag for ovarian cancer. Recognizing this early indicator can lead to prompt diagnosis and improved treatment outcomes, potentially saving lives. 6. Unexplained weight loss or gain. Unexplained weight loss or gain is another important early symptom of ovarian cancer, often dismissed as a result of changes in diet, exercise, or hormonal fluctuations. However, these weight changes can occur rapidly and without any clear explanation, making them a potential red flag for something more serious. Unintentional weight loss may occur due to the body's metabolic changes caused by cancer. Tumors can produce inflammatory molecules that disrupt normal energy use, leading to the breakdown of muscle and fat. Additionally, reduced appetite and early satiety can contribute to significant weight loss. On the other hand, some women experience unexplained weight gain, often due to fluid accumulation in the abdomen, a condition known as ascites. This can make the stomach appear distended and lead to a noticeable increase in waist size, even though it's not related to fat gain or overeating. What makes this symptom particularly concerning is its persistence and the lack of a clear cause. Many women attribute these changes to aging, lifestyle, or other benign conditions, delaying critical medical evaluations. If you notice significant and unexplained changes in your weight, it's essential to consult a healthcare provider. Early detection of ovarian cancer can dramatically improve survival rates, often by identifying the disease before it spreads. Understanding the connection between unexplained weight changes and ovarian cancer is crucial for catching the disease in its earliest and most treatable stages.